Alright, YouTube, so this is my second part of my video that I was saying that I was going to use to talk about, for a brief moment, my surgery coming up. It is at 10 a.m., November 25th of 2011. They're doing a Lyproscopy with a and I never say it right, even though I was in the medical field for years, a histio something or another. Histio something, I don't know. It's where they stick the camera through your vag to be able to see what they're doing with the laparoscopic incisions. What they're going to do is I have what's called a bicornate uterus. Well, technically mine's not bicornate. Bicornate means that there's two different horns in the uterus. So instead of having, a pair, see if I can do this right, a pear-shaped uterus, there we go, a pear-shaped uterus. Some women have a bicornate, which is totally two, which makes two little uteruses like that. And then some women have what's a septum, and it makes their uterus look like a heart. So that's me. I have the heart one, and it almost goes all the way to the bottom to almost make it a bicornate, so they classify me as a bicornate, even though it's technically not attached. This causes a fetus to implant either on one side of my horn or the other, and the fetus will grow and grow and grow and grow and grow till it gets so big that it hits that septum. And one of two things happen. 99.9% probability is the fetus cannot continue to grow, causing fetal reduction syndrome, causing fetal death. This can happen as early as 8 weeks or as late as 20 weeks, just depends on where it goes. Suki was 18 weeks when I lost her in July. My OB believes that going in and having this surgery greatly increases my chances of fertility and increases my chances of having a successful live birth. Now, rewind. Granted, I already have a son, so this makes me very nervous to think that I'm going to have a surgery to do something with my uterus to cause scar tissue, which you cannot say that there won't be any, because when you cut a piece off of a uterus, there's going to be a scar tissue, which will have to stretch during pregnancy, blah, 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 may cause bleeding, all this other stuff. Okay. Besides that, I am a nervous wreck because I hate being put to sleep. I have panic and anxiety problems, and I do not like the thought of being not woken back up. I've had bad experiences with being put to sleep under general anesthesia, and I don't like it. Good note, the doctor doing my surgery has put me to sleep not once, but twice. She has put me to sleep once for my C-section because I don't have an epidural space, which means I can't have an epidural, so I had no pain medicine. They can't do a spinal block because I don't have a spinal space, so they had to put me to sleep. There was no option. And then she also had to put me to sleep to do one of my DNCs. With Suki, I was awake, of course, and she did my DNC there while I was awake because I had already dilated. It wasn't very painful, so I told her to go ahead and do it while I was awake. They just kind of gave me some local numbing down there. So she has already seen how my body reacts to being put to sleep, so that's, a positive note. But I'm nervous about having it done. So anybody out there in YouTube land that's ever had laparoscopic done to fix their uterus or take out an ovary or have a hysterectomy or whatever, just for a basic laparoscopy with a whatever, another, give me your feedback on what it was like, if you got put to sleep. I know she told me it was like an 1.5-hour surgery with a 2-hour recovery time, and then you just go home. So obviously it's not such a traumatic experience because they wouldn't just send you home right after surgery. And it's outpatient, and it's not in a clinic. It's not even done at a hospital. So give me feedback, y'all.